My name is Austin Marks and welcome to my YouTube channel. So I'm currently a respiratory therapist, and on my YouTube channel I mainly talk about respiratory therapy. I do have a few other videos talking about several other things, so if you want to check out my channel, you like what you see, make sure you like and subscribe. So in today's video I want to talk about why so many healthcare professionals are quitting. So to go off of one study that I looked at, in 2018, 400,000 nurses alone quit healthcare. Now this is just nursing. This doesn't include respiratory therapy, physical therapy, if you're a radiologist, technologist, it doesn't matter. That's just nurses alone, and people are getting out of healthcare faster than people are coming into healthcare. So if you look at nurses, once again, there's approximately 150,000 nurses that graduate each year, get their RN, and they start practicing. So we look at that number compared to 400,000, the ratio is totally off. And there are several different reasons why people are quitting healthcare. So if we look at this graph here, we can obviously see that a stressful work environment is the #1 reason as to why nurses quit their jobs. So being a nurse working in healthcare, it's not easy. It's not always the greatest thing. Yes, I do enjoy my job personally. I find it very rewarding. However, it can be very stressful at times. For me, for example, I'm in the ICU a lot and I deal with a lot of crazy stuff. I also work at a trauma center. And once again, a lot of crazy stuff, a lot of stressful environments, because you got everything going on all the time. Patients aren't always the nicest. Sometimes you have 6 patients for one nurse or one respiratory therapist. We're a little different. We have a lot more patients than just 6 generally. But if you're a nurse and you have 6 patients who are on the edge of basically crashing, you can't save them all at the same time, so you're very stressed out because you don't know who's gonna go, who's gonna do what. It's stressful, let's just say that. I remember one night in the ICU, the ICU was completely full, and it was a 10-bed ICU, and there were only 3 nurses. So literally, all these patients need very critical care, but there were only 3 of them. Some of them basically needed 24-hour watch, but the nurses couldn't do that because they had to take care of all the patients at once. They were constantly busy. They were going the entire time. Stating this, I also want to talk about COVID a little bit. So COVID was very stressful for everybody. Respiratory therapists, nurses, physicians, just everyone in general who works in healthcare. Well, anyway, with COVID, once again, if you look at these ratios of nurses to patients, and COVID patients were very bad when we were at our peak. It was not fun, especially when you have to gown up and do all the other stuff to go in because you don't want to get COVID yourself. Plus, with working with all these patients, once again, you didn't know who was going to crash and burn. Plus, just working with COVID alone, if you were in the ICU and you had a lot of patients who were on ventilators, they did not come off that ventilator. We've definitely improved and seen a better prognosis since before in 2020. Well, anyway, just you were a nurse and you were taking care of these patients for 2-3 weeks at a time, and you knew the end result. You knew what was going to happen, but yet you still had to try your hardest, do everything you could for these patients, show you a little bit of empathy, and just be the best nurse you could, even though once again you knew that they were going to end up dying, and that's just not easy on anyone. And then if we look at reason number 2, it's a lack of good management or leadership. So I personally just got a lead role myself. I plan to be a great leader. I want to make sure everyone's happy. I want to make sure everyone gets what they want, while also making sure that my team and me, we all work effectively and get the job done. Well, our ICU just went through something similar to this. So a lot of our nurses actually quit in the ICU because a new leader came in, a new manager, and she did her own thing. She didn't really care what was done before, what everyone else said. She just kind of, okay, I'm the new leader, this is the way it's going to be, and it kind of pissed everyone off, so they quit. This happened as well at a hospital where my mother-in-law used to work. Same thing, she came in, the manager, and just took over, did her own thing, and I think she said like 80% of the people quit just because they couldn't deal with it. Now, I don't want to say there's always a new manager coming in that's going to change things or make people quit. Sometimes it's the person who's been in charge for a while. They just can't manage. They can't keep staff. The place you work at is not a good environment. So therefore, you're not getting what you want, and you're going to end up leaving and going to a better place. And number 3, we have burnout. So burnout is definitely real. Once again, if we look at COVID, a lot of these people just worked. You didn't get any breaks, and just being a nurse in general, sometimes you gotta pee when you can, you gotta eat when you can, because patients come first. You gotta take care of them, and you have no time for yourself, and you're just busy. And this is when burnout comes, because you're doing this day in and day out, and you think to yourself, man, I can be making about this much money as well as doing something that's not as detrimental to my body or to myself or my mind or anything. So burnout is real, especially in the healthcare field, because everyone says, oh, you work in healthcare, you must be making tons of money. No, not really. There are other people who are doing other jobs who are making just as much as us, and they may feel burnout some days just like us, but burnout is real for the nursing community as well as the healthcare community. And once again, I talked about the inadequate staffing, so this leads to the stressful work environments, because you're taking care of all these patients who are on the edge, who may go ahead and start crashing and burning at any time, and you can only code one patient at one time. Well, it depends on the amount of people that you have, but you yourself can only be in one room and at one place at one time. So a lot of places, they can't keep staff, or the staffing is just not there in general, so they want to go to a place where the staffing is great, the staffing is fantastic, and they know that they're not going to be burnt out. Exactly. So it all comes back to a loop, because they know they're not going to be working their butts off the whole time because they have the adequate staffing. And this leads us to our final point, which is better pay and better benefits. So once again, we look at this whole loop, or this whole graph, and we can see that you want to work at a place who has great benefits, great pay, adequate staffing, doesn't have a very stressful work environment, and you're not going to experience burnout. Well, if you find that place, call me up and I'll be right over. You gotta, generally with these places, you take one over the other. So like, I know some places, they have great staffing, like everything is wonderful, but the pay is not the greatest. But other places, you're getting paid fantastic money, but you're working your butt off. So a lot of these travelers who were making a boatload of money during COVID, yes, they went to these places that were high in COVID, had tons of people, but yet they were working, probably had to eat when they could, pee when they could. Very stressful work environment, because, well, like I said, if you work in the ICU and your patient was on a ventilator, you're most likely not going to make it, especially in 2020 when we were at that peak, like I said. So you take what you can. You got to kind of pick and choose with all of these and what's best for your mental health, basically. So one thing about this study in particular is that it was done in 2018. So if you look at 2018, when they had over 400,000 nurses quit, just imagine what it's like now in 2021 after COVID. I know a lot of nurses at my hospital, as well as other healthcare professionals, they got out of the healthcare field because they said, why do I want to keep doing this if it's just going to keep draining me over and over again? So it's getting worse. I heard this quote before, and I'll say this again. COVID did not cause all of these problems in healthcare, but yet it exposed it. So the stress, the burnout, the inadequate staffing, all of that, COVID exposed all of that. And I think a lot of hospitals are now seeing like, oh crap, like we can't keep anybody, or people want to get out of healthcare, we need to hire more people quicker. Or I see a lot more travelers coming in now because they need the nurses, they need the healthcare staff. And then I do want to look at this graph here as well. So this is basically a picture of the United States, and you can kind of see all the different shades of red. Well, anyway, some states actually have laws in place for nurses that they can only take up to so many patients at one time. So as a respiratory therapist, unfortunately, this is not a thing yet. Hopefully it will be, because sometimes you have a ton of ventilators and it's just crazy. But you can obviously see that one state has a very higher chance of a nurse quitting rather than another state. And this is because of some of the laws that are in place to go ahead and make nursing a little bit better of a work environment. And then I do just want to show you this graph. So this is why nurses consider leaving their current job. So the first graph was why they actually were leaving their job, starting with the stressful environment, the lack of leadership, burnout, and etc. that's why they quit, but why they consider quitting mainly is because better pay and benefits. So I know I work at one hospital, and there's another hospital that is literally right across the river, and if they're gonna pay $5 extra an hour, I'm going over there because maybe they're paying for different reasons. Maybe I'm not going over there because, like I said, maybe they have no staffing, so they need to pay their employees more. It all depends, honestly. Like I said, I can't go over this enough, is you just gotta pick and choose. And if you're working in healthcare, you're totally stressed, money can't satisfy you, a work environment can't satisfy you, just healthcare overall is just too much for you, I highly suggest you get another job, because our patients do come first, and you gotta take care of yourself before you can take care of your patients, basically. So this is a problem or a crisis with the healthcare system or the healthcare field, because as you can see, we have more people leaving than coming in. And if we look at the population, we have more people coming to the hospital than we do staff. So this is why we're so understaffed and why you have very long ER visits or wait times, because there's no staffing. Nobody wants to work in healthcare, but there's plenty of people who need treatment. So I highly suggest, if you're into helping people, you want to take care of people, look into healthcare, look into nursing, look into respiratory therapy. Like I said, my YouTube channel is all about respiratory therapy, so you can find tons of information. Well, anyway, I hope you enjoyed this video, hope you found it helpful, and see you in the next one.